Dean Finelli, Ph.D., joins me here on the Newsmaker line. He is partner in the Intellectual Property Department of Seyfarth Shaw LLP's Washington, D.C. office. He's got over 20 years of experience in the pharmaceutical and biotechnology IP management, including in technology licensing transactions, due diligence, prosecution, and litigation. That's all the time we have right now. Thank you, Dr. Dean Finelli. I'm kidding. You got a lot of experience in the industry. So when you first heard about this COVID-19 vaccine tested by Pfizer, they say it's up to 90% effective. That probably had to make you go, this is going to be interesting, because there are 10 other vaccines that are out there in the late stages as well. Dr. Finelli, welcome to the program. Good morning. What were you thinking when you heard about Pfizer's vaccine?
Good morning, Doug. Good to join you. Yeah, I was very excited. If you recall, back in the summer, the FDA set a threshold of anything above 50% effective as what the target was, and I think a lot of people were expecting this to be, 60, 70% effective, as it's one of the initial furthest along candidates. But to hit 90%, it's really exciting news. To be honest, I was pretty surprised when I saw it, but surprised in a very good way. And, this is preliminary. We still have to see once this is published in peer-reviewed journals. But, I suspect that, seeing this 90% number, it should reassure Americans that, things are moving in the right direction.
Now, this is interesting because, again, they're one of a number of different candidates that are out there. How does this whole process work when they go into the USDA review the FDA review, as well as the peer journal review? Because there's one that's just the groups of other doctors that are out there, and the FDA has their own separate sequestered review process.
That's right. So, drug approval process, it's been very politicized, as you know, over the past several months. But the FDA has independent bodies that look at the data, so it's not as if the company itself can say, here's our information, now approve our drug. This is completely independent, and they review this. They look at the safety data in very much detail. They look at the efficacy data to make sure it works. And, that should reassure people as well. When you look at this, 90%, Pfizer's had a lot of success, but you think of some of the other vaccine candidates that you mentioned that have been paused. That's a good thing. That should reassure Americans too that when things go slightly askew, the FDA is going to stop this and look at it in great detail.
Now, we know Dr. Dean Finelli because we've had some trials here at the University of Iowa from some different antivirals. Tell me a little bit more, there's a difference between this vaccine and, say, a Remdesivir that has been touted as something that could help people with the coronavirus.
Yeah, so there's the vaccines, and these are preventatives that, you would basically administer to a healthy person to generate that immune response. So when they come into contact with the coronavirus, they would have that built-in immunity. And then there's therapeutics. Remdesivir is a therapeutic that works by interfering once the virus is actually in the body. It works to, basically stop the replication process, and that's for treating people that are hospitalized. So that would be considered a therapeutic to treat, whereas the vaccines ideally would prevent you from getting it and, more importantly, prevent people from transmitting it.
Dr. Finelli, what's the next thing that we need to be looking at with regard to this Pfizer vaccine that is, they're saying and touting is 90% effective in the trials at this point? What's the next thing we need to be looking for?
So Pfizer will publish their scientific data in peer-reviewed journals, so that'll be something people can look at to, just see in detail what was going on. But the next step, according to Pfizer, is probably about the third week of November, around Thanksgiving. They're going to submit an emergency use authorization application, and that would ideally get this on the market before the end of the year for the highest risk people. So very promising news. Still questions though. How long does the immunity last? How do people that have this, are they able to prevent getting the virus, but also are they able to prevent transmitting the virus? So there's still a lot of studies and a lot of questions that have to be answered. But nonetheless, this is really tremendous news.
Dean Finelli, Ph.D., partner in the IP Department of Seyfarth Shaw's LLP's Washington, D.C. office, joins us here on the Newsmaker line. Dr. Finelli, thanks for joining us in the WMT Morning Show. Have a terrific Tuesday, would you please?
My pleasure. Thank you for having me.
All right, take care. 43 in a cold November rain at Broadcast Park. Today is the 10th. Tomorrow is Veterans Day. Make sure that you are treating a veteran right. If you know a veteran, make sure you grab a cup of coffee, a meal. That's what Veterans Day is about. We salute all those who have served.